So why now? Why did now feel like the time to put this together and roll it out?
Yeah, I think, I'd probably go back, and emphasize my first answer, which is, how aligned are we with our investments, our time and attention, how often we talk about patient safety, how aligned is that with the degree of how important a problem it is. And so I think we in safety, based on the data we see, and even with the progress that we're making, the pace of progress has really slowed, and it's not keeping up with the challenges, quite frankly. And so I think that was a big kind of push. That was a big factor in us kind of starting this work. And I give a lot of credit to the Institute for Healthcare Improvement. They really kind of spearheaded this and convened all of the groups and got this committee started, and this work began in earnest as a result of their time and attention. And so I think that need, I think, really has pushed us all, and it was very reassuring to hear that common observation, almost without exception, across the full committee. I think everybody who has some awareness of patient safety appreciated this fact that while we are making progress, lots of people are working hard. Absolutely, frontline clinicians are working hard. We're just not quite at the same level of the enormous, how enormous the problem is. And I think our current situation with COVID-19, as the healthcare system continues to respond to that pandemic, that's a very clear example that patient safety is more important than ever. In fact, healthcare safety, right, with the safety of clinicians and the healthcare workforce. And so there's a lot more discussion about reliability and resiliency. All those things I think are important. More talk now recently about resiliency and how responsive the healthcare system can be to new challenges like COVID-19. So yeah, I think all those things together have kind of pushed us to act, and get this plan developed.
And I'll actually just add to that a little bit. Agree with everything that that Jeff said. I think since To Err is Human, there's been a recommendation that we need this kind of national coordination, though I'm not sure that would have been the right time. I mean, I think it has taken some time for us to really, all of our collective organizations, to kind of really think about what makes sense to coordinate on and to build expertise and background in this area. So I think that's one thing. But secondly, I want to second what Jeff said about, as we thought about this at the Institute for Healthcare Improvement, and actually part of the reason IHI merged with the National Patient Safety Foundation was concern that things had become complacent. And there was a little bit of a, been there, done that. We've been working on this for 15 or so years, and, it's time to kind of move on to the next challenge. And so that burning platform, or that complacency was starting to really show itself at the National Patient Safety Foundation and at IHI. So we thought, let's merge and be a stronger voice for safety. And then after the merger, as we thought about it, we thought, how can we even get stronger yet and really try to rekindle the efforts around patient safety more, have more urgency, given the fact that we know that we still have so much more to do. And that was really then revisiting this recommendation from To Err is Human and say, I think the time is now that we need to think about bringing everybody together and having this more unified approach. So I think that was kind of the history of how we got to doing it at this particular moment.